Hey, everybody, welcome to today's show. Welcome to Advocate Information Highway. I'm your host, Anthony Lorito-Duke, and we have a really good topic for today's show, in which it is problems with healthcare providers and insurances. So let's get right into this. I think I briefly spoke about this sort of topic before, but I wanted to um, uh, discuss it again, basically, but a little bit more in depth. And um, I'm sure you all know that very recently, especially very recently, the federal government has really been getting on health insurances and stuff like that. And health insurances have also been dropping a lot of medical providers and hospitals and stuff like that. And I say this was the inevitable. And let me explain. For such a long time, medical providers, especially specialists, now, I'm not saying all of them, I'm saying many of them have been doing really wrong to the patients, to the clients, to the consumers by giving false information, misdiagnoses, and stuff like that. And if people call their insurances and complain to their insurances, the insurances would say, like, okay, we got this on file and we're going to save it to the side. And they would say to the client, to the consumer, well, if you're not happy with this provider, we'll help you find another provider for the same medical issue. Okay, but does that really help the situation? Not really, only partially. Partially. And why is that? Contracts, money. Contracts because of the fact that if a medical provider is bad to, let's say, one patient, that same medical provider can be really good to many other uh, patients that have the same insurances. So insurances would say, like, well, we got other clients that go there and they're happy with this medical provider and stuff. So we don't want to take a chance of losing contracts, because if contracts get thrown away, then that puts the consumer in a situation where they would either have to find another health insurance or us another medical provider that's within network of their current health insurances. So yeah, that's what that is. Okay. So but that's why, like, the federal government is getting on insurances and saying, like, listen, if this provider is really not doing right, why aren't you guys really getting on these providers or whatever and really punishing them? And and then when the insurances explain why, the federal government doesn't want to hear that. The federal government would just believe that, okay, you know what? Screw what the patient feels. They either have to find another doctor or find a different insurance. That's how the federal government feels about it. So now, but I want to get into more like what really happened, like, to me personally. And I think I stipulated this before, but I'm going to bring it up again. I think I discussed about um, how a cardiologist did wrong by me. I had this cardiologist for 3 years. Okay, he started off great. Then about a year later, he was absolutely horrible. Okay, and then just a few months ago, he became 50-50. And about 2 years ago, uh, this medical provider, this cardiologist, wrote me out a script for medicine. Luckily, I did not take it and stuff, because if I would have taken this medicine, it would have literally have killed me. And luckily, my husband caught it. My husband caught this, And that's why I did not take this medicine or whatever. And the reason why I did not change the provider at that time was because of the fact that at that time I already had changed cardiologists, and my insurance told me that at that time I can't change a cardiologist again because I changed it so many times and it would look bad on me. But and I would have to wait like a window period to change again, which um, and stuff. So that so that was like 2 years ago when that situation happened, and I let my insurance know what happened. They wrote it up on the in this system. This is what happened. Blah, 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 blah. And um, the cardiologist, he did a bunch of tests on me and stuff like that, and he said that I have a bad heart valve, and I could definitely do the what they call a TAVR heart surgery, which is the really non-invasive, really quick heart surgery. You're basically out by that night or by the next day and stuff. And I says, oh, okay. I was open to that. I was open-minded to that. And he goes, I got a guy at the hospital. He goes, it's a good friend of mine, and he referred me to there. And I did a bunch of tests through the cardiologist, and the cardiologist told me that he sent everything over to this heart surgeon that's his friend, and whatnot. So I go to this heart surgeon, his friend, and and they said, well, we didn't get anything from the cardiologist. Now, I did a bunch of tests with that heart surgeon. Then he tells me that because of my age, and I'm 54 years old now, but this is going back when I was about a year or so ago when I was 53. He goes, because of your age, I'm not going to do. I refuse to do the TAVR heart surgery. He goes to me, tells me, he goes, but if you were in your 80s or 90s and had the same condition, I would definitely do the TAVR heart surgery on you. And I turned around and I called him out on his stuff. I said, what the hell does my age have to do with anything? I said, it doesn't make any sense. I'll explain to you why this provider did this. This certain provider, this particular heart surgeon, the reason why he does this sort of surgery on elderly people is because it's a scam, basically. It's a scam. For elderly people, his mind, he goes, well, these people are not going to live that much longer. So he'll do the heart, he doesn't care, so he'll do the quicker heart surgery on them because they're not going to live long anyhow. And when they do a heart valve replacement, that same valve has to be replaced within like 3 years or so. So in their mind, in this provider's mind, he doesn't care about doing that sort of surgery on an elderly person because he feels that they're going to die soon anyhow, so we really don't care. But for somebody young, like my age, he wanted me to do open heart surgery. And I says, no. I called him out. I says, you're a con artist. You're a con artist. And I said, because the TAVR heart surgery is a quicker surgery, which means less money for you and the hospital. I said, open heart surgery, which is the more complex surgery, is more time in the hospital. Okay, that means more money for you and more money for the hospital. So I found another heart surgeon in a different area. That heart surgeon to me is really a good provider. And he asked me a bunch of questions. He goes, Anthony, do you do any sort of exercises at home, like even or go out for walks and stuff? And I says, yes, I go out for walks with my husband or my aide or both at times. And he goes, well, when you go for walks, do you try to go for longer walks than you normally do? And I said, yes. And he goes, do you get out of breath when you do? I says, no. And I said, I walk really slow. I take my time, but I can go for longer walks, but I don't get out of breath. And he goes, "Oh, this is confirming a big part of my suspicion." And I gave him all the records from the hospital where I was at, or whatever, where I did all the tests from the cardiologist and the other heart surgeon. And he got all the test results, and he looked at it and he goes, "Okay, now this past March, I passed out because of my electrolytes were really low. So I was taken to the hospital, and they did a bunch of tests on me at the local hospital. And they called in my cardiologist, and he goes, well, your bad heart valve improved." He goes, "Because I take Ozempic for losing weight and also for my diabetes, which is a great medicine. I love it. It's been helping me to really lose weight, and it really keeps my diabetes under control. So, anyways," he goes, "Oh, you're losing weight and stuff." He goes, "You look good." And he goes, "Okay, you got the thumbs up to go home." He goes, "Keep working out," because he asked me if I, you know, exercise and stuff at home. And so I said, "Yes, I do." The exercises that a physical therapist has taught me when they were coming to my home, he goes, "But you keep working out and stuff, it's going to really improve your bad heart valve." This is what the cardiologist told me, because they called in my cardiologist to come see me. I said, "Well, you never said that to me before." I said, "Why not?" And he wouldn't answer me, and he walked away. The hospital said that because he visited me in the hospital, I have to do a follow-up with him, which I did yesterday. The cardiologist. So I said, "All right, I'll do it. I'll listen to I listened to rules and regulations," and I did a follow-up with him. And he goes, this this is the same cardiologist I'm talking about. And he goes and tells me, because just a couple of days ago, I passed out from the humidity that we've been having lately. It's been really hot and stuff, so I passed out from humidity. And he goes and tells me, he goes, he did a bunch of tests on me. He tested my the heart, and stuff like that. Everything came back perfect. Everything came back picture perfect. So he goes, "Well, I'm changing my diagnosis from bad heart valve to inner ear infection." Really? Red flags going off like crazy. Bah, 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 bah. Inner ear infection, yeah. Mm-hmm. Yeah. So he tells me, continues to tell me, "Well, if you ever feel dizzy or anything like that, lay down on the bed, lay down in the bed, lay on your back, and raise your legs, keep them up, and it'll pass." Uh-huh. He goes, "And then when it passes, call 911 and tell them you want to go to the hospital, emergency, fast." And I says, "Well, if it passes, why would I want to go to the hospital if it's going to pass?" He wouldn't answer my question. "But you want to change it to inner ear infection." Yeah. And I told him about that at the time in March, when I collapsed and I hit the back of my head. I says, "I got this swelling or a lump or whatever it is in the back of my head by where the head and the neck meet." I says, "It's not inner ear infection, because I have an ENT doctor and I have a hearing aid doctor. If it was inner ear infection, ladies and gentlemen, these doctors would have picked up on that a long time ago, and they didn't. There is no inner ear infection for me." So I call my primary care doctor, and I'll be doing an ultrasound of that part on the head and neck where I feel that swelling or the lump or whatever it is. Because to me, and I'm not a doctor, but I know my own body, and I feel that's what's causing the dizziness or whatever. That's my feeling. What do I know? You know, these doctors got the medical degrees and everything. You know, But anyways, I told this cardiologist, I said, I'm not coming back here anymore. First of all, he treated me like he just didn't give a damn to begin with. He didn't want to hear me. He didn't want to talk to me really. He was just brushing me off. So I called my insurance. I complained about him again. And of course, I'm finding another cardiologist. You know, and I let my insurance know everything that's what's going on and stuff like that. And blah, 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 blah. So this is my whole point of what I've been saying. Problems with providers and medical insurances. And it's a shame that really insurances, their hands are tied. They can't really discipline the medical provider because contracts and other patients, other consumers that they got going to that provider. So, you know, but anyways, I wanted to remind all my fans out there about a couple of things. For the two shows that I host on Spreaker.com, one show is called Super Advocate and the other is called Disabled Reality. I just hosted my show Super Advocate before I hosted this show. For both of those shows, I got a website that you guys can go to and listen to all the episodes of both of my shows that I host on Spreaker.com that I just mentioned. And the name of that website is called Super Advocate. The link to there is superadvocate.codeadx.me. You guys can listen to all the episodes of both of my shows that I just mentioned, but also on this website, there's a tab on there called promo codes. If you guys click on that tab, you'll see 8 promotions on there. And out of those 8 promotions, all of us as Super Advocate, we support 4 of those promotions. And those 4 promotions are Wear Playground, Chill Boys, Hypernatural, and Old Glory. These are great companies. They got great websites. They got great products at great prices. I highly recommend you guys go check them out. And I also want to remind all my fans out there about my other website that I have called Advocate Information Highway. The link to there is AIHNY.com. Again, that's AIHNY.com. You guys can check out all the pages on there, but I just want to mention just a few of the pages that's on there. One page is titled Blog. Another page is titled Shows. Another page is titled Internet Store on Zazzle. And another page is titled Bookstore on Amazon. I highly recommend you guys go check these pages out and stuff. And for the page titled Shows, if you guys go to that page, also on that page, you guys can listen to all the episodes of both of my shows that I host on Spreaker.com, but also on the shows page of my website of Advocate Information Highway. You guys can listen to and watch all the episodes of this show, Advocate Information Highway, AIH for short, that I host here on YouTube. But also on this shows page of my website, you'll see 2 links on there. One link is to the supports page for my show, Super Advocate, and the other link is to the supports page for my other show, Disabled Reality. If you guys click on those links and go to the supports page for those 2 shows, you guys can pay to become members for those 2 shows. And I would really greatly appreciate that. So, but everything is self-explanatory on these pages and stuff like that. So you guys just got to follow the links and follow the instructions and stuff. So I wanted to mention that. And so with that, take care, everybody. Bye.